Hello there, and welcome to another episode of COVID-19 Update here in Chatham-Kent, where we talk to different municipal officials, individuals, and organizations that are doing some amazing things during this trying time. I'm happy to have Dr. David Colby, Chatham-Kent's Medical Officer of Health. Dr. David, thanks for joining me today.
Good morning, Eric. How are you?
Can't complain. As a community, we're getting through this one day at a time, and we have to thank you and our senior levels of government to doing that. First, I got to ask you, how are you and your family doing during this very interesting time in our community, province, and the world?
Well, it's quite isolating, actually. I have one daughter who's locked down in the United Kingdom, and I have another daughter who lives just north of London with three grandkids, and I haven't seen them in 2 months because we are respecting the social distancing rules, and we don't want to spread this around.
Absolutely, and I think all over the world, even our community, COVID has affected us both economically, physically, and even mentally. What have been some of the best resources locally for our municipality?
Well, there's a really excellent network through Health Canada, which provides overall guidance. They instituted the quarantine on coming into Canada because all of our early cases were travel related. We're not seeing that now that the borders are essentially closed. We're not seeing that. But we have constant guidance from the Chief Medical Officer of Health, a colleague and friend of mine, Dr. David Williams. But also during these tough economic times when so many people are laid off and everything, the financial programs that are coming from the federal and provincial governments, I think, are helpful to a lot of folks. So I think there are supports in the community, but are people hurting? Yes, they're hurting economically, they're hurting emotionally because people like to connect with one another. You know, the very idea of not being able to go out and have a meal or a few drinks with, or even some coffee with some friends in a group sounds like something out of a science fiction movie. But here we are, and it's the reality we've been living in.
Yeah, absolutely. With it being the long weekend, this will be playing after the long weekend. Senior levels of government opening places up in phases. People are starting to see, a light at the end of the tunnel, but we still have a long way to go.
We have a long way to go. We are not out of the woods yet when it comes to COVID-19 virus, not at all. So as things gradually open up, this is the initial phase only. I would call it experimental to see how things go. We're going to keep an eye on the new cases that happen daily. There's been a trend, slow but sustained, of falling for over 10 days now. It's been slowly falling. We have to keep that trend. And if we see a reversal of that, we're going to have to rethink this gradual opening. But I really want everybody to remember we have to maintain that physical distancing. That's the number one control measure. It's more important than masks. It's very important to keep away from people.
You've kind of segued to my next questions. Our CK numbers have been different here compared to some of our outlying communities. Resolved, only one death, have shown that we've been doing something right. As our province begins to open up in these phases, how are we going to follow suit based on our numbers?
I would say we are, but I have to say, in deference to jurisdictions that have higher rates, we have a number of things that are different in Chatham-Kent. We have a lower population density, which gives us an advantage right off the bat. We don't have busy borders. Windsor-Essex has to deal with people that are crossing the border and working in the US healthcare system in large numbers of people cross the border to do that. And their healthcare system is absolutely overwhelmed. Unlike ours, I said at the beginning, our measure of success will be if our hospitals are not overwhelmed and anyone that needs oxygen or a respirator will get one and get all the supportive care they need. We have not, knock on wood, been anywhere near that rate now. But we instituted the social distancing policies more extensively and faster than almost any jurisdiction. I declared at the outset as soon as the pandemic was declared by the World Health Organization, I declared a local emergency to enable redeployment of people within the health unit to work on this problem. I closed the schools. The province did it the same day. I was prepared to do it just for Chatham-Kent. And the province closed just the public schools. I closed public schools, private schools, daycares, put a limit on the number of gatherings and the amount of people that could congregate long before that was done by the province. One of the best things that we did was immediately realize that this could be spread in long-term care institutions from staff that are moving from institution to institution with multiple jobs. We put the kibosh on that right away, instituted twice daily screening protocols at the door. Have you been traveling? Have you been sick? Do you have a fever? Do you have a new cough? Questions like that. And we instituted them very, very rapidly. And we scrupulously searched out every case that we could find with liberal testing policies and isolated those people and their contacts. This is not anything brilliant. This is public health 101. You just have to get the energy and divert the resources to be able to get this done. And I think that's why our numbers have been low. If we didn't have the greenhouse outbreak, our numbers would be incredibly low. But again, outbreaks happen. The reason why other jurisdictions are worse off is because they've had other outbreaks. So I in no way want to appear smug or superior. There's a number of factors that have led to us doing well here.
I think we, as a community, look at all the different types of plagues, whether it's the Spanish flu, bubonic plague, even SARS. I don't think we've ever seen anything like this in our lifetime that has affected us on such a big retrospect. So it's just a big eye opener for all of us. So we got to thank you and your team of what they've been doing. And of course, the senior levels of government with their words of advice as well.
I have an amazing team. They come together so well, and we're all in lockstep. I've never heard one complaint about overwork or anything else, and everybody is just contributing so much to this. I am so fortunate. It's not me who deserves the credit. It's the public health unit staff, and the municipal government has been very supportive of as well. Anything that we want, they will give us.
Our municipality has been facing a lot of challenges. So I got to ask you, what have been some of your biggest challenges that you and your team have faced?
Without question, it's been the greenhouse outbreak. This has been, about 2/3 of our cases in Chatham-Kent have been associated with one outbreak at one workplace. And this is ongoing. You've probably been looking at the news. We are getting new cases daily. This has been a real challenge for me because we're facing a huge backlog in the laboratory system right now. So I can test everybody, but if I'm not getting results in a week, it's very hard to make a plan to be able to deal with this well. We're doing the best we can, and the results are trickling in now. So as soon as we're done here, I'm off to have a meeting and discuss exactly what we need to do to continue to manage this. But on the good side, we have 50 people that have completely recovered in that outbreak, and again, the majority of people in Chatham-Kent that have had COVID-19 have done very well. Our hospitals are not clogged up. And by that measure, we're doing excellently. So we just got to stay the course here.
That's definitely the negative turned into a positive. Lots of good news stories around Chatham-Kent. Just recently, we had our May 16th Miracle Project, which is another great thing. Do you have any other good news stories that you might want to share? The greenhouse is definitely a big one because that's been the magnifying glass in Chatham-Kent. Anything else that you might want to shout out to you about good news stories within your department?
Well, really, it's the good news story again, I have to say, is the fact that our hospitals are not overwhelmed. If you look at New York, if you look at Detroit, they have just had a terrible number of cases all at the same time to deal with. So the severe social distancing measures that we put in place here really have blunted this. And in Chatham-Kent, except for that one outbreak that spread in a bunkhouse environment, and we may have to relook at the design of accommodative resources that we have. These places where the workers live, where it's spread, they're not squalid or crowded. They're actually quite nice, and they are inspected and meet all applicable guidelines at every level of government for this. There's nothing wrong with them, but they weren't designed for pandemic prevention. And so we saw those kinds of things go there, but that has been contained. We've got 50 people back to work in that facility who were infected. Nobody was sick enough to go to hospital. Just compare us to Detroit. And again, I'm not trying to act superior. They've had a different reality to live with, and my sympathy goes out to them. They're doing their best, but we are lucky to be where we are. Things are going okay. If you need hospital care, you'll get it.
Yep, we're all in this together.
Absolutely.
I think 2020, for the past 2 months, people will remember this for time and time again, but we're getting through this one day at a time. So we have to thank everyone who's helped us through these trying times. Dr. David Colby, is there anything else that you would like to add as we close up?
Well, I would just like to respectfully remind everyone. I mean, I started the interview by saying this has been very isolating. I have a brand new grandson that I have only held twice, and I'd really like to see him again. I know what it is to be isolated. I think of the people who are isolated in long-term care homes with severe restriction for visitors. It's terribly difficult under those circumstances, but you can't receive visitors if you're not alive, and that's got to be our highest priority. So I would ask everyone in Chatham-Kent to stay the course, and as things gradually open up in this experiment, to make sure it's okay, because we're going to be watching our rates, please maintain your physical distancing. Please follow the rules in stores. Use your hand sanitizer. Stay away from people. Respect the one-way aisles. Don't line up too closely. And if there's any circumstance when you can't follow those things, wear a mask. Masks protect others from you, and it's a courtesy that we can do. It's not something that protects us. You need the full riot gear equipment like healthcare workers wear to really be protected. But we need to stay the course a little bit longer, and we will get through this. And there are many vaccines that are being tested, and if they make it through the testing process showing that they're safe and they work, vaccines are incredibly safe. I'm not worried about that. But we have to make sure that they do the job to protect people. If we can get people vaccinated, we can return to normal, but we'll be smarter and better prepared for the next pandemic that happens, and let's hope it's at least another 100 years before the next one happens.
I'm going to say it's CK, stay the course. You know what? We're getting through this one day at a time. Everyone's in this together. And, when this is all said and done, I hope Chatham-Kent can celebrate with one big giant block party within social safeties, of course, to celebrate all the hardships we've endured. So thanks again for everything you guys are doing.
I think that's a great idea. Thank you very much, Eric, and I hope all your viewers are healthy and well, and they continue to do what they need to do to stay that way. And I'm very thankful for everyone's cooperation.